Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, a woman dies after having an unbelievable 6 plastic surgery procedures at once. This absolutely makes me furious. I'm going to tell you all about it. And then a hantavirus breaks out on a cruise ship. What a nightmare. 3 people dead, and this story is not even close to being over. We're going to go over it. And then finally, elf ears, are they surging in Asia? We've talked about elf ears in the past, but for real, this time it may be happening. I don't know. We're going to find out. I'm your host, plastic surgeon Dr. Bruce Hermann. Kalee Dion-Pear is not here today. She is out of town, but I do have the wonderful Brena in the box.
Hello.
Hi, Brena in the box.
Hello.
You got,
I like that.
Yeah, Brena in the box. You have to help carry me. Like, if I'm up here by myself just talking,
These are some good topics.
This is gonna go down in flames. Good. Well, I'm hoping you can weigh in. I'm gonna be asking you questions.
Okay.
I don't know, just because.
I'm ready. I'll
if
ask
it's just
you
me
some
talking,
too.
people are gonna turn off like instantly. Nobody wants to see that. I need you guys to carry me. Okay, all right. Let's jump in. All right, so first one. So we always talk about these bad outcomes in plastic surgery. And again, I say this all the time. It's not to sensationalize these things at all, but there are things to be learned from them so that hopefully people in the future can avoid similar bad outcomes. And you know, there's things happen. I mean, there's complications and things go bad, but sometimes things are really done poorly by the surgeon, and it really kind of makes me upset. And this is definitely one of these. So this is a story about a woman who died after having 6 plastic surgery procedures at one time. I almost couldn't believe it when I saw the article about this. So the woman's name is Joy Barbara. She's a 48-year-old mother of 2 who lives in North Carolina. And she had some weight loss due to GLP-1s. That's a really common thing. And she wanted to get some body contouring, which is really surging now with the surge in the success rates of Ozempic and other GLP-1 drugs. But she wanted to have all the procedures at once, and she wanted 6 procedures done. So she went to a bunch of plastic surgeons there where she lived in North Carolina, and everybody was like, absolutely no way. Does that sound like a lot to you, Brena, like 6 plastic surgery
I didn't even know that was possible to at least do it all in the same day.
Yeah, I mean, we're going to talk about like how they even did this because just...
And you said North Carolina?
She's from North Carolina.
Oh, okay.
Yeah, she didn't have surgery in North Carolina.
Okay.
She actually had surgery here in Texas.
Oh wow.
Yeah, this is kind of a local story.
Yeah,
Not
I did not expect
but
that.
sort of local. All right, so multiple doctors turned her down, but she kept looking, and finally she got on social media and she found a Dr. Roehl, R-O-E-H-L, never heard of her, out of Houston. Apparently he's got some social media accounts, and started talking with this doctor, and this doctor agreed that she would do all 6 of these procedures at one time. And I want to list out the procedures because like that makes a difference. Like, you know, if it's like 6 mole removals in one procedure,
right,
that's absolutely nothing. I've done that many times. But these are 6 major procedures. So it was liposuction 360, which is basically where they do liposuction all the way around the abdomen and around the backside and the flanks and everything. A tummy tuck, a Brazilian butt lift.
Oh no.
I know, it's getting bad. A breast augmentation and breast lift together. That's actually 2 procedures, but it's generally counted as one. Mm-hmm. So technically it was 7 procedures, but people do combine breast aug and lift literally all the time. A circumferential body lift. Are you familiar with those, Brena? You're familiar with the tummy tuck, right? Tummy tuck? Mm-hmm. Okay, so circumferential body lifts when you do the tummy tuck, but you also take up skin on the backside. Okay. Which is not
that makes sense.
It's not a common procedure. It's more common when people lose big amounts of weight. Mm-hmm. I personally won't do a circumferential body lift. I don't think they're as dangerous as a BBL, and that's clear in the literature about them, but they do have a lot of potential complications. So I just won't do it. I make people wait.
Yeah.
If I have people that need them or want them, like, look, let's do your abdomen, let's get the front done, make sure you do good, then we'll come back and do the back. And then the other one was an extended brachioplasty, which is an arm lift, okay? And the woman came down from North Carolina, came to Houston. Unfortunately, her husband wasn't even able to be here because it was kind of a last-minute thing. I know, it just goes from bad to worse.
Yeah.
and the surgery time was exactly 10 hours. Now,
Okay, I was gonna ask how long it took.
yeah, so 10 hours is a pretty insane amount of time to be under anesthesia.
Yeah.
I question how this person, because I think it was just one surgeon, did this in 10 hours, because I wrote down like my times for these surgeries. And granted, these surgeries can be arranged, right? Sometimes I've done a tummy tuck as fast as 2.5 hours, and sometimes it takes me like over 4 hours. It just depends on the patient,
that
right?
makes sense for sure.
Right. So I wrote down like the shortest times that really I would need to do these. So tummy tuck with lipo, maybe 3 hours. Breast lift and implants, like 3 hours. That'd be flying. Circumferential body lift with lipo, probably 2 hours. Extended brachioplasty or arm lift, that's like minimum 3 hours. I generally take close to 4. And then BBL, which I obviously don't do, but like by the time you process the fat and inject it, like you're looking at another hour. Like absolute minimum time, and I mean absolute minimum time to do these surgeries, in my opinion, which I'm going to talk about how it's a terrible, absolutely just horrible idea, would be 12 hours. Like, I don't know how they did it in 10.
Yeah.
Which makes me wonder,
all
if-
six.
all 6.
That is crazy.
It makes me wonder, I mean, yes, technically you could do one of these surgeries in an hour, but at that point you're really cutting corners, which might, lead you to have serious problems. So like when
I have a stretch question. Not stretch, but sorry to interrupt.
Oh no, go ahead.
Do you think they like started one procedure and worked on another, or like did finish that procedure at one time, then start the next one? Like,
so is it
possible to mix it up?
It's a good question. I mean, most people will start one and finish one. However, because they did lipo 360, they probably took that fat. They did all the liposuction and then harvested the fat for the BBL before they started doing like the abdominoplasty or tummy tuck after the lipo. So, I mean, for all intents and purposes, they probably went in order. But there may have been a little crossover because of the liposuction and the BBL. But yeah, I'm pretty sure it was just one surgeon because, spoiler alert, there's a lawsuit with this, and like the lawsuit names the people, and it names the surgeon and the anesthesiologist, and then other people at the facility, but no other surgeon. So unless one of the nurses was actually scrubbed in doing something, which would be bad, then I think it was just one surgeon. I have no idea how they crammed all that in. So anyway, let's go back to the story. So the patient made it to the recovery room. They got out of surgery, but immediately in the recovery room started having problems with low blood pressure. They checked the hemoglobin. So like when people are bleeding, one of the things that we check, Brena, is hemoglobin levels, which is the oxygen carrying part of our blood. And so like normal hemoglobin is like 12 to 15, and her hemoglobin was 4.6.
Oh, wow.
Yeah, that's that's like critically low.
Okay.
And of course, they did this at a surgery center, which is honestly the right place to do it. Like one of the articles that was talking about this is like, why didn't they do this in the hospital? Well, you can't do a surgery like this in the hospital. It's cost prohibitive. Like all day in the OR would be, $150,000. Like no one's gonna pay for that. Plus you have the risk of all of the superbugs that live in the hospitals. Like I sometimes see people say, oh, why don't they do these cosmetic procedures in a hospital? You can't. I mean, we've had a couple patients that weren't candidates for surgery center, and we tried to price their cosmetic surgery in a hospital, and it was like cost prohibitive. It was like the $6,000 surgery became $30,000.
Yeah.
And so like it's just not possible. But of course it was a surgery center. They didn't have any blood products. They spent about 2 hours in the recovery room before an ambulance showed up to take her to the hospital, which is kind of not good.
Yeah. A lot of waiting time.
Yeah, I don't know if they were trying to see if she would perk up, but I mean, she was like pretty unstable from the get-go. This is all, per the news articles and actually per the lawyers who released like a timeline of the events, which made it really kind of easy to follow.
Yeah.
So after 2 hours, they took her to the hospital and they started resuscitating her, giving her blood products. But at that point, it was just too late. Like what ended up happening is she lost so much blood that her clotting factors basically got all used up. And then she just started bleeding, more or less uncontrollably after she'd already lost a ton of blood. and then it was kind of just a downward spiral from there, and she unfortunately went into cardiac arrest, and although they tried to resuscitate her from that, they were unable to do so. And yeah, they did do an autopsy. This happened last year, by the way. I don't think I mentioned this was not like just happened. This happened last year.
Okay.
And they did an autopsy, and the autopsy showed or reported that she died of hemorrhagic shock, which basically means massive blood loss. But also, she did have fat emboli in her lungs, which is, if you remember, Brena, the really serious and potentially fatal complication of a Brazilian butt lift. So in reality, if you believe the autopsy report, she actually had 2 fatal or potentially fatal things going on: massive blood loss plus a blood clot, or not a blood clot, a fat embolism or fat clot in the lungs. Both of those are definitely can kill you, and she had the 2 of them at one time. There's a lot of questions about the medical records in this. Like, the stated blood loss for the surgery was supposedly 300 cc's, which is unbelievable for that many surgeries. I mean, maybe, but certainly not if you're rushing through them and doing 6 surgeries in 10 hours. But what contradicts that is they use like 90 lap pads, which, there's like an estimate of how much blood is on each lap pad. So, they were estimating she maybe lost 2 liters of blood. Wow. That's all speculation. Mm-hmm. I mean, she obviously lost a ton of blood because her blood pressure when she got into the recovery room was just absolutely terrible. Her hemoglobin was like critically low. I mean, she definitely lost a ton of blood.
I guess it's not related to the surgery, but whenever we did that segment on like where certain plastics, like where there's a lot of plastic surgeons, and what was Houston again? Like, was there a lot of?
Yes,
there?
In fact, yeah,
like
there
over...
are. Yeah, there are. There's there actually, that was the highest category as far as plastic surgeons to demand. Mm-hmm. Meaning,
that's what it was.
Yeah, they have like a huge number of plastic surgeons there in Houston, which is kind of.
I was kind of thinking about that during.
Yeah, historically, Dallas always had kind of like an overabundance of plastic surgeons, but I think here the population has just expanded so fast that the number of surgeons hadn't caught up. But yeah, there are a ton down there. And this was a legit plastic surgeon, by the way, like board certified, legit training plastic surgeon.
What happened to them? Did they lose their job?
Nothing yet.
Okay.
I mean, I think there's going to be fallout. I mean, obviously, there's the lawsuit, right? Mm-hmm. Because, like, kind of like going back to like what went wrong here. I mean, doing all of these procedures at once is just, it's just mind-boggling. I mean, if you look at guidelines for like the American Society of Plastic Surgeon, like this, all of what happened here is way outside of those, and also just way outside common sense. Like me personally, all right, first off, I won't do Brazilian butt lifts. I've said that a million times.
Yeah.
I won't do them. They're too dangerous. I won't do circumferential body lifts. I don't think they're dangerous in that they're gonna kill someone, but they do have higher risks of complications. Like, and not only that, like the recovery is just, very, very hard for that. So I won't do those either. So of the 6 procedures, I won't do 2 of them.
Yeah, that's huge in itself. It says a lot,
right? It
there.
Does, right?
Yeah.
I won't do more than 2 procedures at once. If we're talking like major procedures, like I've done an arm lift and a tummy tuck together. I've done, a breast aug and lift with a tummy tuck. We always include breast aug and lift as one procedure because it is. I do that all the time. I mean, that's like, I do those every week. But I just won't add more surgeries to that. And I don't care if patients are like, patients will come in, they're like, I want 4 procedures. And I'm like, look, pick your favorite 2.
Yeah.
Because I'm not going to do more than 2. And if that means that you're not going to have surgery with me, then I'm fine with that. Like, I don't want people to have problems. And so, for me to say, look, I won't do more than 2 procedures because I think it's too risky. And then for someone to go and do 6 at one time, like, double. What the hell?
I'm really curious if that was, like, she was one eager to just get it over with, or if they even said, we can do it all at once, and it was kind of a selling point for her.
I think it's the latter, because as I said, the girl went to a lot of plastic surgeons with this plan of like, I want 6 surgeries, and they just, like, according to the husband, multiple surgeons were like, absolutely not.
So she just kept trying until she got a yes.
Until she got a yes. And then, of course, this happens, and I mean, I first off, this lawsuit is never going to go to court. There's no way this goes to court. This is going to settle because it's so egregiously bad that there's just no way that anyone would want to try to defend this. And then, then there's the questions like I think for sure there's probably going to be some sort of like board action on this, I would guess. I don't know if that's happening or not. But I mean, I don't think that any like legit plastic surgeon would look at this case and be like, this is just well beyond the pale of safety. Like this is like reckless, like clearly reckless. And it's not, you're not just saying it's reckless. I mean, the proof is in the outcome.
Totally.
And I also wonder if like this might end up resulting in any criminal like stuff. I mean, we see that more and more often these days where, and this never used to happen, where like malpractice would occur, and then like in the past, like malpractice occurred, it was just civil, but now you're seeing it be more sometimes criminal stuff. So I don't know. Like, I mean, this is a really, really bad case.
Yeah. I wonder if the like other Houston surgeons like gossip about it. They're like, did you hear what happened with that surgeon? If they like know of each other.
Oh, I'm sure they do.
Man.
I mean, now that this has hit like the news, because this happened like a year ago, and I guess for a long time nobody, really knew what happened. But then the lawsuit hit, and of course, when the lawsuit hits, and it's got like a headline of woman has 6 surgeries at once and dies, like people take note of that.
Totally.
And so, I don't know what's going to happen with this. I mean, it is all still alleged. There's no, I don't think you would consider like the lawyer's release of events. I mean, they do probably have all the medical records, but whether or not that's accurate is to be determined. I mean, maybe it's not as bad as the stories say it is. I don't know. I mean, there's definitely some question marks, especially about how they did that many surgeries in that time frame.
That's really where I'm just like.
But the autopsy report did say that she had them all, so it's like, I don't know. It seems like this is real, and then it's just hard to believe how someone would do this. Mm-hmm. So I don't know. It's not good though. Yeah. Bad stuff. So all right. Did you hear the very sad and almost infuriating story of the lady who had 6 plastic surgeries at once and died from it? I almost couldn't believe it when I saw it. Now, I personally limit people to 2 major procedures at one time because I think doing more than that is unsafe. And organizations like the American Society of Plastic Surgeons agree with me. There are guidelines for how much surgery time and procedures people should have at one time. Doing 6 procedures at once is just absolutely insane. But it happened to a woman that came from North Carolina to Houston. She had fished around and tried to find a doctor up there that would do these 6 surgeries at once, and everyone told her no. But she found a doctor in Houston who agreed to do it. She went, she had the surgery. It lasted 10 hours, which is a ton of time to have surgery or be under. But during that time, they did 6 procedures. They did lipo 360, an abdominoplasty, breast lift plus implants, BBL, arm lift, and a circumferential body lift. I don't know how they did all that in 10 hours. That's absolutely insane. I calculated I couldn't do that in 12 hours. But she had them all done. When she got to recovery, everything started to go downhill very, very quickly. Her blood pressure dropped. They checked her blood count, which is normally 12 to 15. It was 4. 2 hours later, an ambulance shows up, takes her to the hospital. They tried to resuscitate her, but unfortunately, she passed away. She had an autopsy done, which showed that she died of massive hemorrhagic shock or blood loss, but also she had fat emboli in her lungs from most likely the Brazilian butt lift, which also is a potential fatal thing. So, this is absolutely crazy. Please, people, do not try to have more surgery at once than is safe. Like, bad things really can happen, and this story shows what that can be. So, all right.
Yep. She also traveled for it.
I know. I don't like medical tourism.
Medical tourism.
Too many surgeries at once. Like, it's like all of like the
suspicious
risks. Yeah,
it's surgery time.
All risky. Risky. Okay. All right. Moving on. Did you hear about the crazy outbreak on the cruise ship? Brena?
Yes, I saw this on TikTok, and it was someone like me practicing for the next like pandemic, and I'm gonna be viral the next Charli D'Amelio this time, and I was like, what are they talking about? And then I see it on the news, and I was like, oh my gosh, what
Now,
is happening?
Do you go on cruises? Are you a cruise person?
Not really. I've been on one, and
been
it
on
was
one.
like a
Did you
one
like it?
time. Yeah, the first day was super rocky, so I felt really sick. And
Oh,
I don't
really?
I don't really get seasick really. I mean, I haven't done a whole lot, but
Was it
so
like a
kinda,
massive ship or a smaller ship?
It was Carnival. It was a 5-day like Christmas.
Okay.
It was my sister's graduation /
Okay.
a family Christmas trip. It was
Yeah.
fun, but yeah, it was a 5-day, not 7,
Yeah.
and we didn't really spend that much time off the boat
Yeah.
as I would have liked, but
Yeah.
it was good to experience. I don't know if I would like be eager to go on another cruise. I think I'd rather just like pick my
You know,
my destination.
we've done cruises the last 2 years in a row, and honestly, it's not like my choice. Like our kids really love them.
Yeah.
And so, there's some really cool ones out there, and there's some great cruise lines.
Totally.
I wouldn't consider myself a cruise person, but here I am. I've done 2 in the last 2 years, but yeah, this story kind of makes you wonder about like, should I go on another cruise again? All right, so
Yeah.
this is about the Hantavirus outbreak on a cruise ship that has left 3 people dead. Pretty crazy stuff. So the cruise ship is the MV Hondius. That's a picture of it right there. That's the actual ship. It's a cruise ship run by Ocean.
In the mountains.
So I think
looks
that's
cold.
the
Arctic.
I think that might be Antarctica.
Yeah.
I think.
It's giving Titanic.
It's giving Titanic vibes.
Yeah.
That's the last thing they need is
don't
like,
like it.
hit an iceberg when everyone's got hantavirus.
Totally.
So it's run by Ocean-Wide Expeditions, and this cruise ship that we just showed has experienced an outbreak of hantavirus. You ever heard of hantavirus, Brena?
Now I have.
Now you have?
Yeah.
Yeah, it's a pretty rare one. Like, it's one of those ones that I remember reading about in medical school,
Okay.
but I've never seen.
Yeah,
Although,
my mom said that it's not new. It's just.
no, it's been around forever.
Yeah.
It's not new at all. I want to say, do you remember the actor Gene Hackman?
Oh, I recognize the name, but.
I want to say his wife died of hantavirus.
Oh, no.
Like every year, a few people in the United States, I think it's less than 10, but like a few people die of hantavirus in the United States. Okay, so 8 people have been confirmed to have the virus on the boat, and of them, 3 of them died, which is kind of along the lines of this particular strain of hantavirus, which has a mortality rate of around 30%. Now, this is a small cruise ship. This is not like Carnival Cruise Lines. This is not the Galaxy of the Seas or whatever. This thing carries about 196 passengers and 72 crew. This thing left from, I'm going to butcher this name, Ushuaia. I can't even say it.
Close enough.
Ushuaia, Argentina.
Okay.
People are probably laughing at me. It's like the southernmost city in the world. It's on the very, very tip of Argentina, at the tip of South America. Ushuaia. Ushuaia? This is bad. Okay, I'm just going to move on.
I couldn't do any better.
It left from the southern tip of Argentina, and it was going towards Antarctica, and then it was supposed to go into the Atlantic Ocean, and there's a few islands there in between South America and Africa. So it's kind of a cool cruise, right? Go to Argentina, check that out, check out Antarctica, check out these really cool islands, maybe hit like, the coast of Africa. It sounds pretty awesome, except that 5 days after it left, a Dutchman started having symptoms of hantavirus. And of course, at first, they didn't know what it was. He was having pulmonary symptoms like cough, almost like a flu type thing. And 5 days later, he died. So pretty crazy. So, he got sick. 5 days later, he dies. 2 weeks later, they finally got to one of the islands that was kind of there in between South America and Africa. And I think at this point, maybe 1 or 2 more people had gotten sick. I think they were starting to figure out, okay, maybe we have like a problem here. So the man who died was taken off the boat with his widow, but she became sick. And so they airlifted her to Johannesburg, which is in South Africa. She tried to get on an airplane back to Amsterdam, but they took her off the airplane because she was like so symptomatic.
Oh my gosh.
And she allegedly died later that day in the hospital. So between that stop on Ascension Island is where they stopped at, 30 to 40 people got off the boat. And so these people are potential, carriers of this hantavirus. So these people are now all spread out to their home countries. A few of them have actually come down with hantavirus. In fact, there was a couple on the boat from Texas that have come back, but they say that they're doing okay.
Oh no. Okay.
Yeah. So now this is where it gets crazy. So the ship is now on quarantine. Like, it's still out there in the ocean, because they can't just dump all of these these passengers out into like a port if they're potentially infectious, right?
Right.
So they have everybody quarantined on the ships. They're not supposed to like leave their rooms except for certain times where they're allowed to go walk around the deck, and they're like having all their food like delivered. In the meantime, another woman died of hantavirus on the boat.
Oh my goodness.
So there's like, she's still on it. Now here's where it gets even crazier. So the boat is currently en route to the Canary Islands. So Tenerife, which is a city in the Canary Islands, which are islands right off like the western coast of Africa, but more towards like the Mediterranean Sea, so pretty high up. But like the government of either Tenerife or the Canary Islands is like, no, we can't let all these people off here. Like they're basically saying they don't have the resources to do like a quarantine evacuation of this ship.
Yeah.
So now it's like the cruise people like are just kind of out there on this boat and they can't get off. They're like stuck on this boat. They're all quarantined.
I would hate that so much.
Hantavirus is like,
I would feel so claustrophobic.
Dude, it's like a horror story, man.
Yeah.
It's just like you're on this like pleasure cruise.
New fear unlocked.
Yeah, new fear unlocked, right?
Yeah.
Yeah. So not really sure like how this all is going to play out, because I think they're supposed to get to Tenerife like tomorrow maybe. And will the government let them off the boat? If they don't, they're going to have to travel like further towards, maybe Morocco or Spain or Portugal and figure out how to, get these people off the boat safely and quarantine them and, make sure that this thing doesn't spread.
Yeah.
But it's pretty wild stuff. Yeah, so hantavirus has been around forever. There's actually 40 different strains of hantavirus. I had no idea. Half of them can affect humans. It's carried by rodents.
Yeah.
And they think that the couple that initially started it got it from doing like a excursion there in Argentina.
That would make sense.
Because the version that they actually caught is the Andes version.
Okay.
I don't know where they get these names.
Yeah.
But unfortunately, the Andes version is one of the ones that's a little bit more dangerous to people.
Of course.
Yeah. There's two forms of it. There's like a pulmonary version, which is like the Andes one. And then there's like a hemorrhagic fever one, which is kind of like Ebola, which sounds worse, but I guess it's maybe not as
I haven't heard that word in so long.
Ebola?
Yeah.
I know. Remember when Ebola like came to Dallas and we're like, holy crap, like I'm about to evacuate the city.
Wait, so how is it spread? Do you know?
So it's spread initially from rats, which are basically asymptomatic with it, to humans. But certain strains of it can pass from human to human, and this Andes one is one of them. So it's not like every person has to be in contact with a rat. Like one person's in contact with a rat, they get the hantavirus, and then they spread it to people. Which is kind of like the whole story of that movie Outbreak where everyone got Ebola. Remember that?
Right,
it was like one person got it from a bat or something, and then like it was just pandemonium. I mean, that wasn't really like a true story, but there are outbreaks like that.
Yeah.
Yeah.
So like if I was sweating and I like gave someone a handshake and I had it, like is it like that? Or like a doorknob?
I think it's more respiratory.
Okay.
So, but like if you sneeze in your hand and then you shake someone's hand. I mean, but like, people do that. People do that. People do this all the time.
If you go to the gym and then like you don't wipe off.
Yeah, you go and like
now
open
I'm just
a
gonna be
doorknob.
paranoid like everywhere I go.
You got to keep it's gonna go back to like the gel. Everyone's gonna carry gel and like.
Have you seen the touchless hand spray or hand sanitizer?
No.
It's overpriced from like Ulta or Sephora. It's like $12 for a little like the packaging is just. But yeah, I'm like, hey, at least it's like sanitizer. People are being clean, but
I don't
it's
use
overpriced.
a lot of those gels, but I do wash my hands a lot just because I'm just really conscious about, okay, I touched something, I need to wash my hands.
Yeah.
And it kind of works. Like I rarely get sick, although I did get COVID twice, even with the vaccine.
I did not, but I got.
You never got COVID?
No.
You never got COVID? How did you manage that? Were you living in a bubble?
I don't know. No, not really. I worked at Nothing Bun Cakes during it, and my senior year, I went to, because we had the option to be in school or out of school. That was 2021. Like.
Yeah.
But yeah, I went to school. I never got it.
There's a very high chance that you had it and didn't even know it. Like the 2 times I had it, like the first time I got a fever, and just because COVID was like a thing, I was like, oh, I'm gonna take a COVID test.
I hated the test. Like
I know, it's like,
yeah, it drives me crazy. Yeah,
I don't like that.
My eyes would water immediately.
But the second time I got COVID, like I didn't I don't even know why I took a test. I think I was tired.
I couldn't do it to myself either.
It
I
was
had
so
to have someone
random.
else do it.
But the point is like young people were oftentimes asymptomatic. You may have had it and just never knew it. Yeah, older people were obviously hit a lot harder with that, but yeah, this is crazy stuff. Like this is kind of like a drama playing out on the high seas. You know what I mean? I don't know what's we're gonna have to do an update, I guess, next week to figure out what happened to the poor, passengers and crew of the MV Hondius.
Yeah, I got the Johnson & Johnson vaccine, and I saw something about like it. I don't know, like recently. It was on Twitter. I need to find it again, but I was like, oh no.
Like bad stuff?
Yeah.
Dude,
like,
that vaccine's so gone now.
I know.
Mean, people always
but
say
I got
it's
scared.
like...
I was like, dang,
well,
I wish I'd
like
never got it. But I think it's
No.
required. I don't know.
I wouldn't sweat it.
Yeah.
Like, I took 2 of them, and the only reason I quit taking them was because by the time I was due for another one,
mine was a one and done because I think it was like double in one.
Actually, I did
Johnson &
two.
Johnson.
I did 2 vaccines and a booster, but by the time that wore off, like COVID was basically gone.
Yeah.
And I was just like, yeah, I'm not gonna take it for no reason.
I just remember having the worst body aches the day out, like because I went to
after you took
work
it?
after I got the vaccine. I felt like I got hit by a truck. Like it was awful.
I never had any symptoms whatsoever of the vaccine. And again, when I got COVID, my symptoms when I actually got COVID were really, really mild. But I think it's because I had the vaccine.
Actually,
that's what it does. It keeps you from getting sick.
Yeah, my aunt. Sorry, last thing about COVID at least. My aunt got COVID, I think, a couple of times, and she claims that she still doesn't have smell or taste.
A lot of people say that. Yeah, a lot of people.
Yeah,
say
but
that.
we did the Bean Boozled challenge with her, and she like.
She could taste it.
I was like, are you fibbing?
Grandma just wants attention.
Right. Anyway.
All right. Let me sum up this one. Have you heard about this crazy story on the high seas where a cruise ship, the MV Hondius, has an outbreak of Hantavirus? Hantavirus, that's one you don't hear about a lot. So this cruise ship left from Argentina around April 1st, I believe, on a super long cruise going down to Antarctica and then going up in between South America and Africa, hitting all these stops. Like this is a pretty long cruise. And apparently 5 days after the cruise ship left, one of the passengers got ill. And then 5 days later from that, he passed away. Couple weeks went by, and then they got to an island. The person that had passed away got off the boat, or was taken off the boat with his wife, who at that point was sick. And then I think at this time, the cruise line figured out, hey, we got an outbreak here. So a bunch of people did get off the boat at that time and went back home. The rest of the people got back on. The woman whose husband passed away ended up getting really sick, was flown to Johannesburg, South Africa, and she actually died there, again, from hantavirus. And then another person on the boat died. So now we have 3 deaths on this boat from hantavirus. 8 people confirmed to be sick, either on the boat or of the people that left. And the crazy part is they're still out there at sea with this going on because a lot of places just don't have the ability to take in that many people for quarantine. The boat's supposed to be getting close to the Canary Islands in the next day or so, and then that government said that, look, we're not sure we can take them, so this is kind of a story that's evolving. And can you imagine being on that boat with a outbreak and confined to your room on a cruise ship? It's like new nightmare unlocked. Man, I don't know if I'm going to go on another cruise after this. But yeah, crazy story. Hantavirus is not a common one. We see a few deaths from that in the United States year to year, but not something that you see very often. So this is pretty wild. So we'll keep you updated on what happens. All right, last story. Have you ever been with us when we talked about the elf ears?
I have not.
Dude,
yeah.
we did a couple of segments on this in the early days of this podcast.
Okay.
Well, do you know Grimes, the artist?
Maybe.
She's like a DJ, or she may do like some other stuff aside from DJ.
Is this who the photos are?
No.
Okay,
no.
then.
No,
I
that
don't
girl.
think so.
That girl is a K-pop girl.
Okay, I was like, she looks familiar,
She's
but
a
I don't know
K-pop
her
girl.
name.
Yeah.
Okay.
But okay, so like 4 years ago, roughly 3 or 4 years ago, Grimes, who's like a DJ that was also it's also Elon Musk's baby mama.
Oh. Interesting.
Yeah, it's kind of a weird connection.
I'll
Anyway,
have to look up.
So Grimes got on social media and was asking if anyone knew of a surgeon or a doctor that made elf ears.
Oh.
And we saw that and we're like, oh my God, we got to do an article on this. Because I didn't know that elf ears was a thing.
Yeah.
Like, I was like, this is a thing.
Like they want elf ears?
They want their ears
not
to look
getting
like
rid of- wow.
an elf. You know,
Okay.
like the pointy ears.
Yeah.
And so, like, I'm a total Lord
I
of
thought
the
it would
Rings.
be the opposite, like they're getting rid of them.
No, they want
they
them.
have.
Yeah,
That's
it's
so
like
funny.
it's like up is down, man. Like it's getting crazy.
Yeah.
But like I get it. Like I'm a total Lord of the Rings nerd. Like I think that the elf ears look kind of cool. If I saw a girl with elf ears, I'd be like, dang, that's kind of awesome actually.
Like if you're born with it, cool. But I don't know if I would want to get.
I don't think people are born with elf ears. I've never seen anybody with elf ears. Have you?
No, but it would be a sick Halloween costume.
Dude, it would be super sick. They
To,
would be
like,
like
have-
so different. So
Yeah.
anyway, when Grimes was asking about this, I was like, oh my God, is this a thing? And so like I went on a hunt to see if I could find somebody that was doing elf ears, and I found all these like crappy AI pics of people with
course.
elf ears. I'm like, I was like, that's not real. And so we came to the conclusion
Or
that
the
elf ears
prosthetics.
that it was not really a thing, like the surgery
Yeah.
for elf ears. And then I had this whole discussion about should I be the guy that starts this? I mean, I could probably pull it off. I just it'd be the problem.
Be a trendsetter.
The problem is the first one, right?
Yeah.
The first one you do is going to be basically trial and error.
Totally.
And like, I don't know. I need to maybe go to a cadaver lab and try this. I don't know. Anyway,
Yeah.
so recently there has allegedly been a surge of elf ear procedures in Asia. And of course, I'm getting super excited about this because you guys, I love elf ears. So I had to look this up to see if it was real. This comes from the Wall Street Journal. Oh, I meant to make a picture of the article and I forgot. But if you Google Wall Street Journal and elf ears, it will absolutely pop up. And so I was like super excited because I was like, oh my God, elf ears is going to be a real thing now. I'm about to go take some classes so I can bring this to the United States. The Wall Street Journal says that this is surging in South Korea and China. Okay, those people like to do different things. Like I could see that happening, right? Usually,
Yeah.
Americans are usually up for doing crazy stuff, but they love crazy stuff in South Korea and China as well. And so I got really, really excited, and I started reading the article, and then I was immediately let down.
Oh, no.
Yeah, because what actually people are doing is they're not like making elf ears like Arwen from Lord of the Rings, like pointy ears.
The title is misleading.
I know, right? It's total.
Change the name.
I know. Well, I mean, I made that title because that's the title of the article. But
Yeah.
the Wall Street Journal really kind of sucked me in with I'm going to get elf ears.
Clickbait.
And then what it actually is, and I hope I don't knock my earpiece off, is they're making their ears come out like this.
Okay.
They want prominent ears.
That's not elf.
That's not elf ears. I know.
No.
Come on, man. Don't sell me
I'm
elf
trying to
ears.
think of a good name for that to help.
Prominent ears. I mean, maybe unless you want to come up with like a catchy name.
Right.
But see, that's what they did. They came up with a catchy name. They call them elf ears because that's much cooler than your ears stick
I'm trying
out.
to think of there's like some like characters or something from a movie that have that. in
Alfred
it.
E. Newman from Mad Magazine, which is still a thing.
I want to say like the monkey animal that like I think that might be from Toy Story.
Wait, are you talking about the
Yeah, that
ding,
has
ding,
the
ding, ding,
yeah.
ding? Yeah,
That monkey has those ears, but
got
I
the
don't
ears,
think.
right?
Yeah, monkey ears would not be.
That's probably not good. You probably can't say that. You
Probably
get
not.
canceled or
Don't
something.
quote me.
Yeah, don't say that. It's good brainstorming, but
Thank
no.
you.
Yeah, good. So what these people are doing. So and obviously, your first question might be like, why do they want prominent ears? Because, and I don't know. You tell me, Brena. Does this make my face look thinner when I
don't think so.
I do like
I
that.
think it just looks like you're listening really hard.
Yeah, what? So, well, go back to the picture of that. Let's see, who is that? That is K-pop singer Mimi. Mimi.
Her ears kind of have like a. Do you see
yeah,
the tips
right.
of
I
them?
think
Is that
that
a part of it?
I think that maybe she had something else done. And this is the K-pop group Oh My Girl, which I don't know them. I do know some K-pop people. Like I've actually seen G Idol. Like I'm not ashamed to admit that I've seen. Have you heard of G Idol?
I don't think so.
Okay, they're K-pop. My daughter wanted to go, so I went to a K. And actually, I kind of liked it. I'm not gonna lie.
I bet they're good performers.
They're pretty good, right?
Yeah.
So, but I've never heard of Oh My Girl and Mimi. But apparently, she's pretty famous. And this is her with her elf ears. I'm putting fingers in quotes here with elf. But come to find out that most of the people are not even doing a procedure for this. They're using like these special tapes. And like probably the best way I could describe it, have you ever seen a Breathe Right strip where it's something you stick like on your nose to like open your nose up? So
I should try that because I swear I have a deviated septum. I've told you this. But
I actually use Breathe Right strips because like it helps me breathe at night. I know it's nerdy
just the
old
white
stuff.
ones, right?
Yeah, they're clear. I use clear ones. Yeah.
Okay. I've seen magnetic ones that like literally open.
Magnetic with
Yeah.
oh, like they do and they pull it apart.
Yeah, I think.
Oh wow, that's
I
kind
don't
of
know.
cool.
I think I saw it on TikTok, but
Who
I'll send
knows?
that
Who
to
knows
you.
if it's- yeah, send it to me. Who knows? Maybe it's real. Well, anyway, so I think they're using a type of strip like that
Okay.
that pushes the ear forward. Now, the article did say that people are actually using hyaluronic acid fillers to do this, to actually do a little shaping at the top of the ear, which is kind of a teaser for elf ears. It's not like real elf ears. It kind of looks like that girl. Go back to that girl's pic one more time. It almost looks like she has that. See, her ears are kind of cupped right there. It's like it looks like she had something done maybe. This may be the early stages of the elf ears. You know, it's not full on elf ears where you look like, you know, you just rolled out of Lord of the Rings, but it's kind of like getting there, you know, maybe.
Yeah.
They're going down the road. And they are occasionally doing a more invasive procedure where they use cartilage to basically push the ears forward, allegedly, according to the article. And then, of course, you know, it doesn't give like any pictures of the surgery or anything, but allegedly, which you could do, it's like the reverse of an otoplasty because there actually is a plastic surgery procedure where we fix prominent ears. Like you've seen kids with the ears like this, there's a surgery to pin them back. It's called an otoplasty.
It's the opposite, yeah.
Yeah, it's the opposite. I don't do otoplasties just because just not my bag. But it is a thing. So this is kind of like a reverse otoplasty. And then it did say, it was a teaser. It's like, oh, and by the way, there might be some people like shaping their ears with surgery, which is what I was looking for. And I got disappointed.
Dang.
So yeah,
Maybe you should invent it. Another reason to
I'm
start
tempted.
It. Yeah.
I bet you if I could do this and I threw a web
Find
page
someone
up,
who wants it too.
man, it's just that first surgery would be like, 'cause I mean, it would be very three-dimensional because the hard part would be making the curve of the ear look right because you'd basically want to cut the ear to shape it, and then you'd have to get the edge right. Like the soft tissue is not hard. Like I could do that, and I'm pretty sure I could do the cartilage too. It's just I've never tried to do anything like that. I've done a lot of ear work for like cancer and stuff.
Yeah, I was gonna say
like,
the ear is super like.
it's very three-dimensional.
Yeah.
But I mean, it's pretty easy to work on. I've done a lot of ear trauma, ear cancers, and I'm pretty sure I can do an elf ear. It's just that first one. It's like, ugh. It's like the person who, you know, did base jumping the first time. They're probably like, this should go all right, but no one's ever done it. You know what I mean?
It should be someone that's an actor and is
Oh
in a
yeah,
lot
I
of
want to do it on a
roles.
celebrity at first.
Yes.
No,
because that's when people really start to turn their heads and be like, oh. So I think someone that's in like a Star Wars series or some kind of.
I think if I could pull off a good elf ear, that I would have people come from far and wide to get elf ears.
Totally, it would blow up.
It would blow. I need to spare. I guess if I really was going to do this, I would probably go to like a cadaver lab and see if I could, you know, because there are they call them cadaver labs where you can, you know, do surgical procedures. Like that's a thing, and that's where I'd have to do it just to be like, okay, if I shape it, you know, bend the cartilage, suture it, pull the skin back over, does it look okay? Yeah, I'm pretty sure I could pull it off. It's just that first one.
Oh, you know, like the Green Goblin from Spider-Man?
Yeah.
That guy. Let's call him.
Yeah, that would be good. Yeah. Yeah, I'm gonna have to figure this out. I think I could be like the next big thing, like the
this
elf ear
summer
guy.
Because the Spider-Man movie's coming out this
Right.
summer, so
We're gonna
that
have
would be
people
a
that want
good
it.
thing to look into.
All right, let me recap it. We have done segments on elf ears so many times, and every time I'm so disappointed because these articles will say that elf ear surgery is here, and I'm thinking, sweet, Lord of the Rings, where do I sign up to figure out how I can do this? Because I know people want this, and then it's not really elf ears. But a Wall Street Journal article just was talking about how there's a surge of elf ears in China and South Korea. However, what it is actually these people are making their ears more prominent. They're doing things to push their ears forward, which makes their face look thinner. It's not real elf ears like Lord of the Rings style, which was a total disappointment. How are they doing this? Well, they're actually doing it non-procedurally, sometimes just with special tapes like Breathe Right stripes or Breathe Right strips. Sometimes they're using filler to push the ears forward, and occasionally they are doing surgery for it. And there was a teaser in the article that sometimes people are shaping the ears to look like elves, but yet there was no link, no proof. The elusive elf ear is still out there until I'm just going to have to invent this procedure because I know there's a demand for people that want elf ears. Yep, it's going to happen. So, all right. All right, Brena, we did it.
We did.
Yeah, we managed to like push through. It was actually really good. Like,
this was a good one.
It was a good episode. So thank you so much for your contributions. They're always much appreciated. Okay, everybody, thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It really helps us so much. And leave us a comment if you want us to do a specific topic on the next episode of Nip Talk. Bye.